Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
Great. Thank you for having me.
Yeah, I'm excited. I know we've been kind of going back and forth for a while now. I'm glad we were finally able to get something on the calendar, and I think we should just kind of kick things right off. I'd love if you could tell the audience a little bit about yourself, and we'll go from there.
Sure, thanks, Jared. So Dr. Angela Fusaro, I am an emergency medicine physician. I'm based here in Atlanta, Georgia. Recently a faculty member at the School of Medicine at Emory University. And, when you're an ER doctor, you really see like the best and worst of humanity every day. You're sitting at the gateway into the healthcare system. And so I think it was really through that experience and through that lens that I was motivated to start Physician 360.
Atlanta. I've been hearing some big things about Atlanta lately. That I mean, I know it was always really on the rise, growing, but like mainly too from like a tech perspective, how the tech community is growing. How have you seen things grow just in the city? How do you like being a part of the Atlanta like entrepreneur ecosystem? I wasn't planning on asking you that, but I'm just curious.
Yeah, it's funny because I actually answered that question earlier for someone, and I was thinking about it, and I was, like in life there are certain things where you're like, oh, I really like just missed the window of opportunity there, or I was a little late to that idea or a little late to that party. I feel the total opposite about Atlanta. I feel like I was a trendsetter. Like I was here, and we are now just about to really hit our prime. I think, for those of us who've been part of the tech scene and the health tech, digital health community, we've always seen the potential. But I think just recently we're really starting to get national attention for one, just the talent, the brilliance, the number of resources that are here, and then combined with what I call like this very scrappy culture of Atlanta. I think it's like the perfect combination of things for entrepreneurs. So yeah, I love being here. I've loved starting the company here.
Was that part of so you were saying you were already there and then you started it wasn't it what you didn't move there for the company like I have been seeing some companies do. Okay.
I was here already, but I do think that part of my experience, being again at Emory, seeing the clinical elements there, collaborating with folks at Georgia Tech, I was exposed in a way early on when I came to Atlanta that definitely guided my personal journey. Definitely played a role in how I got to this place. So, yeah.
Perfect. Okay. Yeah, I'm excited to learn more. Can you tell us about Physician 360, I guess, in some more detail, how you started it, why you started it, and kind of how it all works?
Absolutely. So, our mission is really about reimagining the practice of urgent care. And the guiding principle we used was about, we looked at the simplicity of the pregnancy test, and we said, why don't we have something like that for other simple medical illnesses like a UTI or flu? And, that's effectively what we did. We said, why can't you walk into a local pharmacy, which, by the way, there's one on like within a few miles of 90% of Americans. So there's a neighborhood pharmacy everywhere. Why can't you walk into a neighborhood pharmacy, purchase a test kit, interact with a doctor on your smartphone, and then be walking out of that same pharmacy, less than 30 minutes later, for oftentimes less than $50 with a treatment prescription. And that's effectively what we built. It's, Physician 360 it's a virtual health clinic. So we transform these neighborhood pharmacies into urgent cares by providing them access to on-demand telemedicine consultations, via a network of doctors, and then rapid tests. And so a patient can now get a truly comprehensive virtual experience that's very comparable to what they would have experienced if they went to a traditional medical appointment.
Okay, that makes sense.
And I think, why did we start it? I was like, I don't know, you look like a very healthy person, so perhaps you've never had the experience of how disruptive something as simple as a UTI can be. But for all of us, like everyday people who are juggling a million things, it seemed just so unreasonable that there wouldn't be a cost-effective, convenient, diagnostically accurate, and safe, option for care. And so it was just one of those like, gosh, I can order like I don't know, gene therapy from my phone these days. I can like, you know, there's so many things you can do. Why can't I bring together all the component parts to deliver a comprehensive experience for something so simple?
Interesting. And were you a lone founder with this company?
I have a co-founder, Dr. Rob Laporte. He is based in the suburbs of Dallas. So we have two offices, and he is our chief medical officer. So really instrumental in guiding the patient and the provider experience, because we really felt commitment not only to making it awesome for the patient, but really creating an experience that from the doctor's perspective was paramount. Was great.
Now, this is a question I ask every guest, especially because it's been a crazy year, right? 2020 has been something with the pandemic. I would love to kind of hear how COVID-19 affected your business in any way, positively, negatively. It seems like anyone in the digital health space saw some increase just based on it. People are home, they want this type of digital care. I'd love to hear kind of how things worked out for you.
Sure. Yeah, I think for the most part, it has been a tailwind. The conversation I was having in 2019 is decidedly different than the one I tend to have now. Now, everyone really acknowledges and recognizes telemedicine as the new frontier in healthcare. Um, you know, the first practical impact COVID really had for us was that no one wanted to go to the doctor for any reason, and so it really accelerated our expansion of products and services. Um, we were getting there. The goal was always to be able to service any condition you otherwise would have gone to an urgent care for, but COVID really accelerated that. So we brought into our product and service suite earlier this year. And then, we were well positioned to play a meaningful role in the pandemic. We were already expert at testing and treating for time sensitive conditions. So it made sense that we would do the same for COVID. So we did roll out COVID testing options for patients, and we did roll out testing programs in partnership with our pharmacies. So for the most part, it has been a tailwind. I will say there's a lot of, I guess the trade-off is that there's a ton of entrants into the market now. So I think there is a lot of noise, and really being clear with your customers, clear with your investors about what is your differentiator, and that's become so much more relevant.
Where can people learn more about the company?
Probably our website's the best place, so physician360.co. And you can follow us on social media. We're fairly active there. And we do have, about 1,000 pharmacies in our network. So there is a decent chance that you live near one of them. So you can go to our store locator and even, visit one of our partner pharmacies.
Perfect. Yeah, and I'll throw some links to for your social media channels, and also to the website in the show notes, so people will be able to easily navigate towards that. Perfect. Well, hey, thanks so much again for joining me on the podcast. I'm excited we were able to have you on as a guest, and look forward to being able to share this with others, and they can learn more about the company on their own from there.
So thanks so much for having me, Jared.
Absolutely.